So let's look at normal breastfeeding patterns because it can be confusing. Babies usually do not feed on a regular schedule for the first 6 weeks, which is why you feed on demand. The baby tells you when it wants to eat by giving cues, and the mom listens. Most babies cluster feed and then they'll have a longer break and they'll sleep. Babies may feed every half hour or every hour. It's all normal. Some babies may go from breast to breast for hours at a time, and these long stretches tend to happen more at night, as I mentioned earlier. These are not signs that the baby isn't getting enough. These are signs of normal, healthy breastfeeding. The most important lesson for your grandchild to learn is that his or her needs will be met. That's why it's important to watch the baby and feed the baby when the baby wants to eat and not the clock. There are no set schedules for breastfeeding. The only time I encourage moms to watch the clock is in the early days after the baby is born. If the baby is too sleepy to wake up and eat on its own, I'll ask them to watch the clock and wake the baby up to feed it. Baby chooses how often it's eating unless there's a slow weight gain and you need to watch the clock to wake the baby up and remind it that it needs to eat. With an increase in milk, you hear the baby swallow. Babies tend to be more content for longer periods of time between those feedings, but they're still cluster feeding, and that's normal. Remember, it's normal. Longer sleep stretches, now the baby may go 4 to 5 hours to sleep, where in the early days, maybe you only got 1 4 to 5 hour stretch in a 24-hour day. It's okay not to wake that baby up to eat as long as the baby is nursing at least 8 to 12 times a day. Feedings can last an average of 20 to 40 minutes, and that can vary to a baby may do 5 to 10 minutes at a feeding. And a lot of that depends on how much milk the mother has and how fast it comes out. One breast or both breasts at some or all feedings is all normal. Some babies will do both breasts, some babies will do one breast. And again, that depends on the supply and how quickly the milk comes out. So you want to make sure that baby stays on the breast long enough so that it gets the fattier milk, because it's the fattier milk that puts the weight on, and it also satiates the baby for longer periods of time. Some babies feed faster. They feed fewer times during the day, and they pass fewer stools. That's normal for them. Some babies nurse longer, more often, and they pass huge numbers of stools. Baby should be gaining at least 5 ounces a week. If the baby's gaining 5 ounces or more a week, it's normal. It's average. It's just every baby is a little bit different. If the baby is thriving, all is fine.